I'm Rebecca Darby. I'm a student physical therapist assistant with Jeff State, and today we'll be discussing necrotizing fasciitis. We'll be talking about what it is, how you get this disease, the diagnosis of this disease, as well as the prognosis, and then we'll also be talking about how it's treated both medically and therapeutically. So what is necrotizing fasciitis? It's a toxic bacterial infection that spreads rapidly throughout the body and can be extremely deadly. This disease is more commonly known to the public as flesh-eating disease, which somewhat describes what it does to the body. It affects the superficial and deep fascia in the body and causes those tissues to die due to the toxicity of the bacteria that's infecting the area. So a recent story that all of you may remember is just last year in 2012, Amy Copeland, who's a college student from Georgia, contracted necrotizing fasciitis after she fell from a zip line with her friends. And she sustained a cut on her leg which allowed the bacteria to enter her body, and she nearly died from the falling infection. She ended up requiring amputation of parts of all 4 of her limbs, including her right foot, most of her left leg, and both of her hands and forearms up to her elbows. So this picture here you see to the left is of her walking onto the Katie Couric show about 4 months after her injury. And she's using a double platform walker, and at this point she had received 1 prosthesis for her leg, so she's using that. So, how do you get this disease? Well, you can get necrotizing fasciitis as a result of a number of different bacteria, but some of the most common bacteria are group alpha and group beta hemolytic streptococcus bacteria, as well as streptococcus pyogenes, which is the same bacteria that causes strep throat. You can also get it from E. coli, as well as Staphylococcus aureus, other gram-positive and gram-negative aerobic bacteria, as well as anaerobic bacteria. And when tested, most patients with necrotizing fasciitis have more than one of these bacteria in their body. So, there's a lot of different ways you can get these bacteria into your body. Some of the most common studies that have looked at patients who have necrotizing fasciitis, these are some of the most common ways that they got the disease, and that's through minor skin infections, intravenous or IV drug use, which we'll see later. People that use IV drugs have a high risk for developing necrotizing fasciitis. You can also get it from minor trauma or surgery, animal or insect bites, perirectal abscesses, or an incarcerated hernia, which is just when a portion of the bowel where the intestine becomes trapped and then the bowel becomes obstructed. So basically any penetration of the skin or opening in the body can allow the bacteria to enter the body. So some of the most common areas of infection are the upper and lower extremities, the perineum, and the abdominal wall. So who's affected by this disease? Anyone can develop necrotizing fasciitis, including someone who's young and perfectly healthy, but there are a few groups of people who have a higher risk to develop this disease. And as I mentioned previously, those that use IV drugs are at a risk for it because of the lack of hygiene that's usually associated with that, as well as the high number of opportunities they have for the bacteria to enter their body, since it can enter anytime the skin is penetrated. Also, patients who have diabetes or peripheral vascular disease, anyone over the age of 50, anyone who is obese or who suffers from malnutrition, and also any patient who is immunosuppressed in any way is going to be at a higher risk for this disease just because they're not able to fight off the infection as well. So, necrotizing fasciitis, the diagnosis can be difficult early on in the process because 2 of the first signs are pain and fever, which are associated with tons of other infections, so it can be difficult to distinguish from other infections. And in addition, the skin often shows no signs of what's going on underneath early on in the process. So physicians will use full thickness tissue biopsies, x-rays, CT scans, MRIs, and ultrasounds to detect the infection, see how far it's spread, and also to distinguish it from other soft tissue infections. So, and then surgical exploration is often necessary to definitively diagnose necrotizing fasciitis. As far as the prognosis for this disease, the biggest key in determining prognosis for patients is whether or not they received early treatment. That's the most important key with this disease. The longer treatment is delayed with necrotizing fasciitis, the more the mortality rate increases. So, studies on necrotizing fasciitis report a wide-ranging mortality rate, including anywhere from 6.1% to 76%. So it's absolutely a potentially deadly infection, but with early treatment, patients can make a full recovery as possible. They also may experience something somewhere in the middle. They may have to deal with an amputation or a disfigured extremity or some other impairment as a result of the infection. So common medical treatments, early surgery is used often to debride and remove any dead tissue, as well as search for where healthy tissue is. And that's extremely important for patients with necrotizing fasciitis. Aggressive antibiotic therapy is also very important for these patients. They want to give them very strong antibiotics and a wide range of antibiotics to cover all the bacteria that could be causing this. So nutritional support and supportive care are also used as treatments, and amputation may be necessary as well to keep the infection from spreading and to save the patient's life. So, according to the Guide to Physical Therapist Practice, necrotizing fasciitis can cause many physical impairments, such as impaired skin and sensation, muscle weakness, impaired joint integrity, decreased range of motion, as well as other impairments that are associated with abnormal fluid distribution. So each patient's going to have different impairments based on what part of the body is affected and how badly it's affected. But these impairments can lead to functional limitations for these patients. They may have decreased balance, especially if they do require an amputation of a limb. They may have a decreased ability to perform transfers and gait due to weakness or the inability to use an extremity, and therefore they may have a decreased functional mobility. So all those things can lead to certain disabilities for patients. That may include the amputation of one or more extremities. It may lead to an inability to return to work or to care for one's family at the same level that they did prior to their illness. So how are we going to treat this in physical therapy? Well, the best way is to follow the Guide to PT Practice. Necrotizing fasciitis falls under practice pattern 7E. So physical therapy clinicians can look at that for extensive information on how to treat the disease. But some of the ways to treat it are through therapeutic exercise for range of motion, strengthening, balance, hydrotherapy, transfer and gait training in order to regain mobility for patients, and also functional training for work or home. And then they also want to educate them on any assistive devices, orthoses, prostheses that they may need to use, and they want to work on repairing the integumentary system, the skin that's been affected by this disease, and protecting that skin. And physical, mechanical, and electrotherapeutic modalities are also options for treatment. So, another option is hyperbaric oxygen treatment. This is a very specialized treatment, so it's not seen as commonly, but it can be useful for patients with necrotizing fasciitis to help heal the skin. So this is an example of a hyperbaric oxygen chamber and what it looks like when a patient is in that. And then here's a before and after picture of someone who's had hyperbaric oxygen treatment on their foot. So implications for the therapist for necrotizing fasciitis. There's some possible precautions or contraindications depending on the patient. They may have an impaired or absent sensation in an area, which is a precaution or contraindication for many modalities, so they just want to be sure to carefully test sensation before using those. In addition, if they're treating the patient while their infection is still active, they want to make sure to wear the appropriate personal protective equipment and clean all equipment that the patient uses. So how does this disease affect treatment? Treatment is going to vary widely for patients with necrotizing fasciitis depending on the extent of their tissue damage, whether they had to have surgery, how many surgeries they had to have, if they had any amputations as a part of the disease, and also other comorbidities will affect their treatment. Could be diabetes, could be peripheral vascular disease, or any other type of immunosuppressed disorder. So, in conclusion, what we've learned about necrotizing fasciitis is it's a rapidly spreading, potentially deadly bacterial infection. Requires quick and aggressive medical treatment in order for a good prognosis for the patient, and often leads to impairments and disabilities for patients, but those can be treated with physical therapy. And as always, treatment for these patients is going to be patient dependent. So thank you for listening, and if you have any questions, please feel free to comment or post on the discussion board.